is just a huge honor for me today to be podcast interviewing Jasmin Haley, RDH, BSDH, CDA. She's coming in today from Baltimore, Maryland, where they built the first dental school in the world and has the dental museum. Have you ever gone down there?
Yes, I have, and I'm taking my children too. They love it.
And how old are your children?
I have an 8-year-old and a 5-year-old. And my 8-year-old says she's going to be a dental hygienist, which is, I'm telling her, don't be a dentist because I want free dental treatment. I'm trying to secure myself when I'm elderly.
Jasmin is the founder of Beyond the Prophy and co-founder of MOMgienists. She is an adjunct instructor at Howard Community College and consultant educator with the Jacques Initiative with the Institute of Human Virology. She has 15 years experience as a clinician, educator, and dental assistant. Jasmin helps the hygiene community to think beyond the prophy by inspiring and empowering professionals to give the best patient-centered care, reach their greatest potential, and explore career options that promote excellence. She regularly writes on her Beyond the Prophy blog and is co-host of the MOMgienists Podcast with fellow colleague and friend Christie Lincoln, RDH. She is enrolled at the first dental hygiene school in the world, Fones School of Dental Hygiene, in their graduate program with the dual concentration of public health and education. She can be reached at info@beyondtheprophy. I'm a huge fan of your podcast. You have 29 episodes. Tell us about your journey where you decided to start a podcast.
Oh my goodness. Okay, so Christy and I have been very, very good friends for a really long time. We have had such an amazing friendship. We have children. We share lots of things. We have a good time. So we wanted to do something together. I came back from an event with ADHA, and I had met Elijah Desmond, and we had talked about having a business, doing something together. So we wanted to do something that was related to being mothers, because that's what was taking most of our life at that time. And we started with vlogs. We started video vlogs, and they were horrible. It was very difficult for us to get together. I had to worry about my hair. The kids were walking in as we were trying to film. It was a disaster. So we were fans of A Tale of Two Hygienists with Michelle Strange and Andrew Johnston. And I said, you know what? It's really hard for us to get together. Let us try to record it. Just record the audio when the kids are sleeping at night. And so that was it. We started the podcast, and we've taken it from there.
So you have two websites. Which one should my homies go to? You mentioned Elijah Desmond. He was on episode 460, Smiles at Sea with Elijah Desmond. The guy's got so much energy. But you have two websites. You have Beyond the Prophy and MOMgienists. What's the difference between Beyond the Prophy website or MOMgienists, which is a play on Mom Hygienist, MOMgienists. I love the name. It's an awesome name. And I love what you write on MOMgienists. It says, meet Christy and Jasmin, dental hygienists plus friends plus moms plus 9 years plus 5 kids later equal MOMgienists. Healthcare moms who understand the struggles, the joys, and self-doubts of raising kids, staying sane, and working. Listen to our regular conversations about everything except the kitchen sink. I love all those pictures on there. Episode 28, advocate for public health and the underserved. Episode 27, can display incredible resilience when overcoming challenges. The episodes are just amazing. So it seems like you have so many passions. Dorothy Ferrari, MOMgienists, who takes on the international world with fierceness. 25, fearless transit professional with Rock Shockey, RDH. I love this one. Episode 24, take on professional bullying part 2. Now, are you teaching people to be a better bully or how to defend against the bully? Which side are you on the bullying?
Oh, how to defend against it, how to deal with it. It's interesting. So I'll go back. I'm going to backtrack. So Beyond the Prophy was my first start. I realized I wasn't happy with my career. I wanted to have a little bit more autonomy, be able to control it, be able to speak on what my passion was. So I created Beyond the Prophy. It's a CE company. And what I'm focusing on is leading by example, connecting peer set leaders, as well as educating them by helping them to think outside of the box. So I started the blog with that, and I'm hosting CE events with Beyond the Prophy. And then MOMgienists is more of a really fun side where we're building a community of mothers. We have a few dadgenists who dare to listen to our podcast. And we've only had one dadgenist come on, and that was Andrew. We actually have another one, an upcoming episode coming up. But that's really meant to provide the support that we need in our field. I was finding that in the forums when I was reading, there was so much bitterness about our profession and so many people unhappy. And I felt that way. I can relate to that. And so I wanted to be able to bring what I learned in my journey of mindfulness, bringing my mindset to another level of excellence and really thinking outside of the box and creating opportunities. And so essentially it's doing that with both. It's connecting, building a relationship with those who are willing to believe in our mission and join us for the fun. So
what percent, first of all, do you know how many hygienists are in the United States? What numbers?
Around 185,000.
185,000?
Yes.
And is that 185,000 are those who actually work, or just people who have a license, an RDH license in America?
I believe it's who has an RDH license in America. That figure comes from the ADHA. I'm not too sure on how they classify that. And I'm sure there's a boatload of mothers, grandmothers, dads, those who deal with parenthood. When you add in the complexity of parenthood and being a professional, it blows your mind. It's one of the hardest things to really create a true work-life balance. And I think that's what MOMgienists is bringing, is an outlet for us to be able to talk and have the support that we need. They do it in other industries. It's just not really being done with ours.
What percent of those 185,000 hygienists do you think are burned out or unsatisfied, or don't find being a hygienist professionally rewarding and makes them happy and makes them all that in a bag of chips?
I believe, probably over 90%.
90% or what? How would you describe those 90%?
Oh man, frustrated. They are feeling unfulfilled. They see some of them are leaving the profession and going into becoming RNs or other different fields because they feel like they have no autonomy. They've reached a glass ceiling. So I would say, from looking at the forums, and this is without doing any type of research, there's a lot of hygienists that are dissatisfied with the career, which is why you see so many groups where you have like Beyond the Operatory. I believe the doctor's name is Dr. Stefano. Then you have Trapped in the Op, which is another community forum for hygienists who are looking to get outside of clinical practice.
Beyond the OP, just Beyond the Op? And where's that?
Beyond the Operatory.
Beyond the Operatory, and where's that?
And, I understand the complexities of dentistry when you have $300,000+ in loans. It's a business mindset. They have this pressure of all this overhead and all this other things on them. And so a lot of times they're not making decisions that the hygienist can fully understand. So there's so many things here. And of course, I'm loyal to my hygiene friends, but I think there's so much. I like to start first at the curriculum, elevating their thinking, and then reshaping the profession.
I am just loyal to the patients. I'll throw my homies, the dentist, the hygienist. I'll throw everybody under the kitchen sink if it's what's best for the patient. Let's go with you talk about leadership, communication, entrepreneurship. Under entrepreneurship, do you think independent practice, if that was nationally legal, that would provide for a lot more entrepreneurship? I've always been a very big proponent of independent practice because I just think it promotes competition. I think competition is what's best for the consumer. I always get frustrated when you go on a cruise and the only things they have is, you can get your hair done. I'm bald. You can get a mani-pedi, but that really doesn't do anything. I still don't understand why people want sea salt rubbed into their calf. I thought salt causes high blood pressure. But I just want to get my teeth cleaned. And when I go to a 5-star resort, I wouldn't mind going to the spa and getting a cleaning or bleaching or something like that, but it's not legal. And I always thought, why? Access to care is huge. Why would, and everyone that I've ever seen, I've only seen like 7 independent practice hygienists in my entire life. And they were always in a town of like 1,000 in the middle of nowhere. And they took out their dining room table and put an operatory. And if they see anything wrong, they write a referral slip to the dentist that's 20, 30 miles away. And that dentist loves it. He just loves it. I mean, yeah, you're sending him a patient once a day that has a cavity, a broken tooth. I mean, they just completely love it. And I just think it's a knee-jerk reaction when everybody goes to Washington, D.C. and says, I don't want my industry to have competition. It's, it's just so, I think it's a union mentality. But do you think independent practitioner, coast to coast, would be a good start for dental hygiene entrepreneurism, or were you thinking other stuff?
Oh, I was just recently in Annapolis this year, and I didn't have a chance to sit in to hear the dentists actually talk about their opposition to dental therapy, which essentially allow us to get into nursing home facilities and other areas where people aren't deserved. So this is a little bit different from independent practice. I feel like independent practice will never happen in Maryland in my lifetime. So we'll just go to advanced dental.
In your lifetime, you're still just a baby.
I'm 32. I don't think it's going to happen. But with the advanced dental therapists, when I viewed and listened to those dentists that were in opposition, they're scared. When I think about entrepreneurship, I think about dental hygienists taking their skills and creating a business outside of clinical practice. That's my focus. Now, as far as clinical practice, I would love to be able to own a practice and be able to provide care for that. But I'm trying to be politically correct right now.
My definition, I like what you say, because my definition of an entrepreneur is anyone who can make money while they're sleeping. And, if you can only feed your family by doing live eye-hand surgery or laying bricks or welding or whatever, you're really committed to manual labor. And dentists are just extremely high-skilled manual laborers. And, we're plumbers. A cardiovascular surgeon, what's the difference between that and a plumber? He's taking out a clogged pipe from your heart and replacing it with a cleaner pipe from your leg. But yeah, it's nice to be able to diversify your income so that if something happened, car wreck, disease, getting older, it is nice to make money while you're not sleeping. I meant, do hygienists, is part of their, so let's go to the hygienists. I have a feeling all the evidence I have is most of the people listening to the show are probably dentists under 30. And I tell you on the show, if you're a dentist over 30, please email me, howard@dentaltown.com. And about once a month, it's the once a month, somebody will email me and say, dude, I'm as old as you. I had one last month that said, I'm 64. And what's funny, he's retired. I said, why do you listen to the show if you're retired. And he says, well, just because you retire, you're still a dentist. He says, I still love dentistry. But let's go back. Talk to the dentist listening to you right now. What do dentists do that frustrates the hygienist? Well, how could dentists be better employees better employers for their hygienist?
Wow. Ooh. They just need to be able to listen. Take off the hat of a clinician, which is difficult, and be able to listen to what their hygienists are saying. We have been trained where we're not just giving a cleaning. We're providing hygiene services. We're prevention specialists. That is our specialty. And it's very difficult to come into practices where you have been trained a certain way in dental hygiene school, and you've been trained to provide the best patient-centered care. And when you come to practices, the dentist doesn't acknowledge your training. They don't empower you as a clinician, and it is very difficult for many hygienists to swallow that. An additional thing for that is some hygienists are in situations where the dentist is not favorable when they are new mothers, if they need to nurse, supporting them through that. Another aspect that they find is very difficult is when the dentists tell them to clock out when there's no patient that shows up. Oh my goodness, there's a whole lot of things that happen with it. And I think really what it needs to start with is open communication. The dental hygienist needs to feel comfortable enough to be able to share their concerns, and the dentist needs to just lay it out there, especially when it comes to the business aspect. If there's things that you're not able to do, explain that to your particular practice.
What percent of the hygienists disagree with the diagnosing and treatment plan of their employer dentist?
Oh my goodness!
And do you think it is affected by the amount of debt? Do you think a 54-year-old fat dentist who doesn't have student loans diagnoses more conservative than a 25-year-old who's got to pay $350,000 of student loans and $750,000 on a brand new practice? Do you think, or is that just too cynical? Do you think the dentist still has their heart in the right place no matter their financial status, or do you think desperate people do desperate things?
I've seen both. I've seen very conservative dentists, and I've seen who watch. I've seen dentists who are more aggressive because they have to pay their bills. I've seen all of that. I can't tell you. When I meet people, I believe initially that they're coming from a good place and they have good intentions. So I'm not going to label the dentist of thinking any particular way, including hygienists.
I think you can label the bald dentists. They always seem to be the better batch of dentists. Would you agree that the fat, old, bald dentists are always better? It's the young, good-looking ones with hair that you got to not trust. Well, I wish we had more insurance data because I know dentists who are very successful. They lecture about how successful they are. They don't ever do a filling. I mean, every time so many dentists would do a DO or an MOD, they're doing a crown. I mean, so when some guy says, well, I do 100 crowns a month, I want to see more data. Well, does that mean you're also doing 900 fillings a month? Mm-hmm. I mean, it's one thing to say I do 100 crowns a month if you do 900 fillings, but you do 100 crowns a month and do 9 fillings. I don't want my children to go to you.
Yeah, I don't get it. I mean, I was just recently at a practice and I temp. I no longer work permanently anywhere, but I was recently at a practice and I saw this woman and I provided her assessment. I did her oral cancer screening. I checked her periodontal pocketing. She had mobility in the mandibular anterior, and she was using all this occlusal force on the anterior, no posterior teeth. No one discussed replacing the teeth in the posterior. And when I mentioned that to the doctor, because she's suffering also from some abfractions around her premolars, his suggestion was to do a class 5 restoration on the abfraction on number 4 and nothing. I had spent like maybe 20 minutes talking about her replacing her posterior teeth, and that was his treatment plan. Why? I have no clue. I have no clue at all. So
Now, do most dentists let you co-diagnose and explain to the patient and go over the x-rays and all that? How many of them are free to just let you just do your art for an hour? How many are control freaks, say, hey, you're not a doctor, you can't diagnose, quit saying stuff like that?
I mean, you can find both of them. I understand why they can be controlling, because you want to make sure that whoever is providing the co-diagnosis is in alignment with you. So I feel that that's okay. I feel like you have to fill each other out and figure out if you guys have the same philosophy. And if you don't, then the hygienist needs to leave, if that's the case. But you can, I don't know, you find both. You find both.
I always call it the remote control syndrome. I mean, the remote control, every house I've ever been in my life, nobody knows how to use all the buttons on a remote control, because when they design the remote control, you have all these people come from the VCR, the CD, the cable, the TV, and everybody has to get their damn buttons on there. So you end up with 80 buttons, whereas companies like Apple say, no, Google, it's about the customer. The customer doesn't want 90 buttons and doesn't care about your little silos and departments. And what I've always done in my hygiene department is the patient comes first, and the hygienist would always say, well, we legally can't diagnose x-rays. And I said, okay, well, if you can find me one hygienist in prison today serving time for reading an x-ray, then I'll grant you your excuse. But it's just an excuse. And I said, I want you to read the x-ray, especially like you. I'm 54, you're 32. I could have made you at age 22 and been your dad. I'm sure you have a better eyeball than me at looking at an x-ray. I mean, I wouldn't want some 80-year-old man reading an x-ray. You know what I mean? So I have always been the co-diagnosis. You're in there, you read the x-rays, you write it down. And then when I come in, and if I disagree with, say you say it's a watch on 29, and I say it's a do, then we both zip our lips and we bring in who's ever available, another hygienist, another dentist, someone comes in there, and we say, and everybody knows their culture, it's a democracy, and then that hygienist or dentist will say, whatever they say it's a do, now it's 2-1, and then you're right. And then if I feel like it needs to be a learning experience, then I'll get that person back where, let's say you said it was a watch and I said it was a do. And then I'm doing a DO. As soon as I break through, then I go get you and say, come here and look at that x-ray again, then look in the tooth, and you'll see like oatmeal I'm taking out with a number 4 round burr. But I always thought the patient comes first, co-diagnosing is everything. I think they believe you 1,000 times more than they believe the dentist, because you're an employee and the dentist owns the business. So you would have far less financial incentives to be selling anything. I
definitely think it's a collaborative approach. I think, and also when the hygienist is very respectful of where the dentist position is, I think that helps as well. So if I find that there's some concern, I may mention it to the patient, I may explain it, but then I tell them that the dentist is the one that makes the final decision. He will be the one that would diagnose that. But you will hear me explain to the dentist that this is an area of concern for me today. So I think having a collaborative approach is always the right course to follow, but you find that there are some dentists that don't prefer that. In fact, my friend Christie explained that when she was first practicing, a dentist felt that, oh, she's good, but she's okay. She'll be a great hygienist one day. And another dentist took that opportunity and shaped her into the amazing clinician that she is. When I have a question about clinical care, I go to Christy, and it's because her dentist took the time to train her specifically for over 10 years and elevated her to a way that clinicians really should be as dental hygienists. So I think it should be a collaborative team approach, and I don't know how much of that they spend in actually training with that. But it's interesting that now that I'm thinking about collaboration with the consulting that I'm doing with the Jacques Initiative with the Institute of Human Virology, they've actually taken this program that's centered around persons living with HIV and AIDS, and they are focused on interprofessional care. So they're actually training dentists, medical students, dental hygiene students, pharmacy students, nursing students, law students, social worker students, all together on how to care for persons living with HIV and AIDS. So I feel like for the future of dentistry, we're going to see more collaboration, more interprofessional care compared to what we've seen in the past.
I think the people who have the most insights are the hygienists who temp, because if I talk to a hygienist that's been in one office for 30 years, I mean, she has no idea what's going on in the marketplace unless she has a big social network. But how many offices have you temped in?
Oh, a ton.
And what tell these dentists, what do you think better, more fun, rewarding professional offices that are successful do more than the ones that are stressful and unhappy and miserable? What do the successful dental offices do better?
The successful dental offices, they communicate. They have an open dialogue. You know exactly what's going on in the business. You know how much you have to make for that day. You know where you're lacking, what your projected goal is. You're able to give your concerns, and they let you be a clinician. They're not micromanaging. There's some liberties that you feel comfortable in doing. When I temp, I actually bring my own instruments. I have my own little kit when I'm there.
Well, how many kits do you have to have for sterilization?
I have 5, and I use American Eagle instruments because they're sharpen free. That XB technology, I love that. And I was introduced to that just recently this year. And
Who introduced you to that?
Lewis Myers and Karen Siebert. They introduced me to XB technology, and I haven't looked back since. So I think
Lewis is just what a great guy, and he's I like his ambition. When he wanted to be on my podcast, you know what he did? He flew down to Phoenix, Arizona, and said, "What's your favorite restaurant?" and took me and my boys, and we talked about it. I don't remember a thing we said because we were drinking all night, but that was a joke. And I mean, he's the most connected man in dental hygiene. I mean, he knows every mover, shaker, hygienist out there, and he's just I just love his work ethic and all that stuff. But anyway, I want to say one thing before I forget. I think the best movie that every hygienist and dental assistant should watch. Did you ever see the movie 20 Feet from Stardom?
No.
Oh my God, one of the greatest movies ever. Filmmaker Morgan Neville shines a long overdue spotlight on hit-making contribution of longtime backup singers. And basically so a couple of years ago, this woman gets inducted into the Rock and Roll Hall of Fame. And everybody's like, well, how could you make it to the Rock and Roll Hall of Fame when I've never even heard you on the radio? Who is it? And what the Rock and Roll Hall of Fame figured out is that the greatest musicians of the 70s allowed their backup singers to just go for it. And this movie showing like Mick Jagger, like and there was this one backup singer, I wish I would remember her name, that whenever she would just start belting it out, Mick would shut up and take 3 steps back. So would David Bowie. So would all the greats. And then they were interviewing these backup singers, and they said, who sang on a lot of one-hit wonders, and they'd call them cheaters. And the lead guy of the band would say, no, these are the words you sang, and you're singing too loud, and you're drowning me out, and I don't want the drum and the guitar and the backup. And they were control freaks, and they said it was their end. But he said the people who were all the legendary bands knew that chick's been singing in gospel churches since she was 3 years old, and her voice is better. I mean, Mick Jagger, does Mick Jagger have a voice? Who the hell told Mick Jagger he could sing? And but you listen to his tracks without his backup singers, you realize Mick ain't a good singer, but he would have the self-esteem to find the very best backup singers. Most of them were from the South that grew up in gospel, and they could. And Mick was like, man, if you can take it, and it was just a great deal. And that's the same thing with the hygienist and assistant and dentist. The best dentists are the ones. Sometimes Jan will get mad at me, like I'd be making a temporary, and she don't know what I'm thinking or going wrong or whatever, and she'll just say, let me do it, and I just back up. I let her do it. And if the hygienist wants to present an entire implant, build up the posterior because there's abfractions and mobile teeth, I mean, I'm going to let her go. Yeah. And it just takes a lot of, and that's why I predict success with these young kids when they come out of school. If they're humble, so they listen to their staff, they listen to their pay, they listen to podcasts, they listen to see. If they're humble, if they're hungry, they're hustlers, they got a big work ethic, and they're curious. They won't, when something fails, they don't get mad or quit doing it or refer it the rest of their life. They go, God, I wonder why that failed. So if you're humble, hungry, and curious, you'll crush it in plumbing, welding. I mean, anything you go into, you'll crush it. But yeah, what's that movie? It is just a lesson on why you should, that the whole is greater than the sum of its parts. And it's not about you. That's arrogance, conceit. It's not about you. It's about your team.
I was watching a video. I just wrote about this in my newsletter. Arnold Schwarzenegger did a keynote for a school, and he doesn't believe in the term self-made man because he feels that collectively throughout his journey of his career, he's had all these individuals support him. And I feel that when we have that type of mindset and we view it as a team effort, wherever that may be, whatever road you're taking in your journey, I feel that it makes your life more fulfilled. You'll have more success than you realize. So I think that team effort is absolutely necessary for dentists. We value you, dentists. We value you, hygienists. We value the dental assistants. Each of us have our own expertise, and then collectively we can build an outstanding.
Yeah, these self-made men, would they have been a self-made man if they were born alone on an island?
Yeah, yeah.
And talk about luck. Would they have been a self-made man if they were born in Iraq during a war or during Afghanistan? I mean, so much of what we do is luck, being in a good country, luck with great mentors. So much of it's luck. I want to ask you the most serious question of the podcast. What % of dentists do you think are batshit crazy?
I am not answering that. Oh my goodness! But you know what?
Come on! Release round off. Is it 1 in 4? Is it half? Is it 3/4? Or is it actually all of them?
I think anyone in dentistry is crazy. I think anyone that chooses this profession is a little crazy. If anyone can go inside the mouth and provide care, I think we're all a little touched, and I think that's what makes us all very special.
You were talking about. I want to ask you another controversial question. You were talking about this lady had no posterior teeth, she had anterior mobility, and there was an abfraction. And Doc's best idea was to treat an abfraction, probably with a filling. It's still a controversy. It's even a controversy on Wikipedia. Wikipedia says they don't know if it's from improper toothbrushing or if it's from mechanical forcing and flexure. What do you think? And maybe the world does know, and no one's updated the Wikipedia page. What are they teaching at your school as the cause, the etiology of an abfraction, which is a non-carious lesion on the cervical part of the tooth?
Oh, I think that's a little backdated. But first thing we teach them to do is never go to Wikipedia. The second
Seriously, do you? Yeah. Really?
Yes, because Wikipedia, anybody can put in information that's not a reliable, credible source. So the second thing is we want them, what I tell my students is that if you see that someone's missing posterior teeth, we're looking at the occlusal forces distributed incorrectly. And obviously you can see that with the anterior mobility. So the first thing is to restore some stability in the mouth by replacing the missing teeth, if there's room for that. And so that would have been my recommendation for that patient. Although I'm not trained as a dentist. I'm just sharing what I've learned over the years with working with different dentists.
But have you ever stayed in a Holiday Inn Express?
Have I ever stayed in a Holiday Inn? Probably. But you know what, Howard? I really wanted to talk about a little bit about what I've been speaking about in my CEs, which is about diversity. I think dental professionals should start preparing themselves for changing their thinking because it's evolving. So historically, in your generation and in my mother's generation, diversity was considered black and white. And now we have to include gender identity and sexual orientation. And some of the opportunities I've had in sharing that, some professionals were like, well, what does this have to do with clinical practice? Why does it matter? Don't we treat everyone the same? What difference does it make? And I noticed that in your event this year, you had a very, very interesting CE class working with
I
patients with
wonder which
transgender.
one that was.
And I actually was happy to see that because of the clinical aspect that you shared. I focus more on the communication, the cultural, cross-cultural communication that happens with people, and understanding how much culture affects communication with each of us, how important that is, but also for us to realize that now we need to be prepared to look at a different demographic that is being shown to not receive the kind of care that they need. So I've been finding it very interesting to seeing how dental professionals are reacting to that from the courses that I give. I wanted to know what the reaction was for your course at your event.
Well, that was Dr. Kevin Koch, and he eventually became Annie Koch. And I have lived through, it's a dear issue of mine. I have a couple of dear issues that I grew up with. So I grew up in an extremely conservative Republican Kansas family where communism was evil and blah, blah, blah. And my little brother was Liberace. And everybody knew it when he was 5 that he was just completely gay. And I saw the abuse and the making him feel bad. I saw the literature from the CDC about how young teenage gay boys are one of the highest groups of suicides. I saw he eventually moved to Sydney, Australia to get away from it. And I told him, I said, man, if I was born gay in Kansas, I'd have been on the first gay train to San Francisco. I would not live in a state where 90% of all the people thought I was going to go to hell for eternity, especially when those are 2 of your older sisters who are Catholic nuns, your own mom. I mean, so they just didn't get it. And then the other issue that I was very dear to was I had 5 sisters. And my own parents would put me in jeans and put iron patches on the outside, and I had no curfew and could swim in the river. And they put them in dresses, and they had to be on with the street light on. They could not be within 10 feet of it was just crazy. And I remember swimming out in the middle of the Arkansas River, looking at my 5 sisters standing back from the edge, thinking, if I start to drown, am I supposed to hang on to my wiener, or what does the wiener have to do with me swimming in the river? And I just think it's horrible how much hatred there is in society. And I was watching on Vice News the other night. It was so sad. They said that once this war with ISIS gets over in Iraq, then both the Sunnis and the Shiites say then they're going to go to war with each other and separate Iraq, break up Iraq. It's like, my God. And the difference in a Sunni and a Shiite is like the difference in a Catholic and a Lutheran. I mean, just minor details. And I believe, this is what I believe as a healthcare provider. I'm a dentist, and I don't like dentists who, I'm not saying it's just not my taste when they try to do their marketing just to cosmetics or just for implants. I mean, I'm the dental office right here in Ahwatukee, and if you come through my door, you need a dentist. I don't care if you're gay, I don't care if you're old, young, I don't care if you need me to fix your baby, your grandma, your denture, imagine you broke your leg and you went to the hospital and they say, Jasmin, we don't do legs. We only do arms. And, and I think the patient, I'm a doctor for my patients, and I'm going to treat anyone who comes in the door. And and if anybody thinks that homosexuality is a choice, it's just because they didn't have a little gay brother. And anybody who thinks transgender, transsexual, things like that are bizarre. How can it not make sense that when 3.6 billion base pairs, we're not mitosis like a fungi, we're meiosis. These pairs pull apart, match someone else. Who's to say that you didn't get a girl brain and a boy genital, or a boy brain and a girl genital? Who's to say?
I think what professionals are missing are not understanding. I totally hear you, but I feel that hygienists or just dental professionals in general shouldn't be concerned about how they came about with that decision. They need to understand historically what disparities are they facing, what's the common terminology that they use, and how can I create a safe place for them when I provide them care. It doesn't mean that you need to change your personal beliefs. It doesn't mean that you lose your identity by providing more compassionate care. And I think that's where they're falling prey to feelings of, I don't know whether it's fear, because I've gotten from when I've spoken on my courses, and you expect to get people who are not always going to like what you have to say. And I know that it's not personal, but I've had people completely irate, like totally against any type of topic that has to deal with talking about the evolution of diversity and preparing ourselves as professionals to treat every single patient. And it's very interesting to hear you say that each of us have our own particular story, but I think it's important that we stay open to whatever changes that do occur as far as cultural changes, and be open to that, and if you feel like, well, I'm not too sure, why are we even talking about that? Then you need to attend a course that's actually speaking about how things are changing and how we can become prepared for that.
Do you think the dental chart should be changed from most every chart just says male, female?
Mm-hmm.
Do you think there should be a third box, a fourth? Would you think the chart should be changed?
Yes.
What did Annie say? Would you add a third category? Facebook added like what, 50, 70?
I don't even know. I haven't used any of the things, but yes, I do recommend that. And there are some other recommendations that I make in my CE class, making sure that you can allow the person to put a preferred name on there, because a lot of times those who are trans are not able or have not changed their legal name. And so you never want to be in a situation where you actually call someone in your waiting area with their legal name that may be male, but they're living their life as a trans woman. So those are things that you can add in there. You can even add in there where you have single, married, and divorce. You can put partner, long-term partner.
I never understand single, married, divorced. First of all, divorce is dumb because they never put it plural. It should say single, married, divorced. How many times? And plus, if you're divorced, you are single. And instead of married, why don't they just say married or victim? But yeah, I mean, I don't understand half of this. Like, look at the health history questions. I understand asking if they're diabetic. I understand asking their medications, but why do you ask if you've ever tested positive for syphilis, gonorrhea, or chlamydia? What does your college days have to do with getting a root canal when you're 40? I mean, how
well, you know what? Are we trying to bridge this gap? Are we trying to bridge the gap between the oral systemic link? So, I mean, we know everything.
But there's got to be, whether or not, I took it off my chart clear back in 87 when this retired guy in Phoenix wearing a military hat wanted to see me private in the office, and then he breaks down because I asked him if he ever had gonorrhea, and he's telling me that he had a 2-day pass in the Philippines in World War II, and he got it, but he's afraid he doesn't want his wife to see it on the chart, and he never told his wife. And I'm just sitting there thinking, why do I care if you had gonorrhea in World War II? Why? How does that? If it doesn't affect dentists, that'd be like asking if they live in a 3-bedroom house or an apartment or a trailer. How does living in a fifth wheel affect my diagnosis? How does having gonorrhea 50 years ago affect my treatment plan? If there's a connection, an oral systemic link connection, I'd rather you ask finance questions. Have you had your same? No, really, I'm serious, because have you had your same job for 2 years? Have you? Because if it costs more than $1,000, 90% of Americans have to finance it. So if I'm really committed to oral health care, I don't want to go in there and say, well, your treatment plan is $1,900. And would you like to give me a check or a credit card? I'd rather her go in there and say, wow, you have outstanding credit. We can do everything the doctor and hygienist talked about for just $145 a month for 36 months. That's a better doctor. I'm going to understand my patient so that you can get all the treatment you need, not asking if you had gonorrhea
I disagree with that. I disagree. And the reason why is, yes, you don't need to know what they had 50 years ago. You can ask within the last 10 years. But if we're trying to look at holistic care at the whole entire person, if you know that your particular patient's at risk for STDs because of certain types of behavior, then you know that in your, which they call the dental hygiene process of care, in your assessment, some of the things that you're going to be recommending to them is you need to see a routine physician. Here's a possible referral. You need to see, you need your physical. When was the last time you had a physical? If they come in and they tell you, well, I don't know, and I'm eating like this. So we're looking at more than just, let me take care of your mouth. There's nutritional counseling. There could be counseling made for them for if they're high risk for high blood pressure, diabetic, whatever. So those certain aspects, when we start eliminating that, we're not really seeing ourselves as true professionals that treat the entire system. This is the portal entry of everything else. But we need to be prepared to really look at it and see things as interprofessional care. Where can we refer the patient? They may not have immediate dental needs.
I'm going to stay with STDs for a minute. I think the most bizarre thing in that dental hygienists do in dental offices is that a hygienist has 4 years of college, a registered nurse has 4 years of college. 8,000 to 38,000 Americans die each year from the flu. And when I look at the CDC research of where those 8 to 38,000 people entered the healthcare system the last time, dental offices are the top 3. Why are we measuring them for periodontal disease when we're not giving grandma a flu shot? How many lives could have been saved if the hygienist doing the flu shot? And now with HPV and oral pharyngeal cancer, they're saying that they want that you need to be vaccinated before you get the HPV virus. How come I can go into Walgreens and CVC and a farm tech can give me a flu shot, and my hygienist with 4 years of college can? Why can that tech give me the HPV vaccine? And the last time I went to the doctor, I needed some booster shot. I think it was tetanus, and he said, "Well, just go to Walgreens or CVC." And I said, "Well, you're going to give me a prescription?" He says, "You don't even need a prescription for it." I'm like, I don't even need a prescription for it, but my hygienist can't do it. And then in one state, finally, one progressive state, Tennessee, which didn't surprise me because that's the state that invented Jack Daniels. So those guys know how to think. Why does America not bring their 185,000 hygienists and 211,000 licensed dentists to the front signs of the flu shot? And the one thing I also want to say, everybody always thinks about 20% of Americans think the sky is falling. Like if you go into 100 churches, 20% think the end of the world's coming. If you go into Wall Street, 20% think the market's going to crash and you buy gold. And then you say to the guy, well, let's say every bad thing happens and we do go into depression. What the hell are you going to do with your gold bars? You going to eat them? You going to drink them? I mean, they're only good for jewelry and dental fillings. What are you going to do? You come home, honey, we lost our job. We're out of water. We're out of food. So I made you a nice gold necklace with matching earrings. I mean, 20% of people, I believe, are just batshit crazy from here to Kathmandu. Every century has been better than the century before, going back 15,000 years. So we're at 2017. 17 years into the last century, we already had the Spanish influenza and 5% of the entire planet died. Philadelphia bought their first steam engine because they couldn't build graves fast enough. And here we are 17 years into the 21st century, and not only, no one's talking about, hey, all you anti-vax people, can we get a hand because we didn't listen to you and we didn't have 5% of the entire planet die? Oh, no. But the anti-vax people are on TV saying vaccines cause, all these other diseases and autism and all that stuff. So it looks like no matter what you do, 20% of the planet is still just oblivious to any data. I think the first 17 years of this planet, of this century, are 10 times better. The last century, the Great Depression, 2 world wars, Vietnam, Korea. I think this is going to be mankind's finest century. 1880, 80% of Earthlings could not read or write. Now, half the planet has a smartphone and
Mhm.
can get on Wikipedia, even if it's not right on abfractions or it's not good enough for doctors and hygienists. I agree, but it's a lot better than my encyclopedias that my mom bought me at a garage sale that were made 10 years before I was born, and she bought them for me when I was age 10. I mean, I was reading 20-year-old Britannicas, but
I had
this
them
is our
too. I had them
finest.
too at home.
This is going to be our finest century, but I think hygienists and dentists need to get our rights to give HPV vaccines and flu shots. But back to the
I don't know if
conservative.
that's gonna. I don't know if that right there is something that is important that will come down the line. But first, there needs to be some evolution happening in the dental hygiene profession first. I mean, there's some. I'm just thinking about other issues with not having enough time to provide the best care for your patients. How are we supposed to get everything that needs to get done and provide a flu vaccine and all the assessments and all that stuff that we learn in 30 minutes?
Well,
Or
I think instead
45
of
minutes.
cleaning off all the tartar and stain, it'd be a lot easier just to take an extra oral photo and then Photoshop it.
Good point.
That's
You go. You're done.
That's how you
Have a good
increase your
day.
productivity. That's what I do with cavities. A lot of times I'll take an X-ray, and if they have like 12 cavities and I don't want to fix them, I just Photoshop them.
Okay.
It's so much easier and faster. So I want to ask you the most important question. Here's the
Okay.
most important question. If
Okay.
I line up 100 dentists and I say, what stresses you out the most? What keeps you up at night? What makes you not want to go to work? It's never my fillings are falling out, my root canals are failing. It's never any of that. It's always HR. It's always staff. He's like, my assistant and my hygienist, they're always going at it, but the patients love it. My office manager, she's so moody. You know, she'll come in Monday, Tuesday, Wednesday and be the most adorable lady in the world. And Thursday she'll come in and she's Jekyll and Hyde. And and so what they do is after every procedure, they run back to their office and shut the door
Mhm.
because they just can't deal with staff. You've been in so many offices. How come some offices don't have drama and other offices do? And what percent of the office would you say the leadership, the communication, talking about what's the break even point for the day, our goals, concerns? And when you talk about communication, they only communicate because they feel safe to talk. Some offices, they feel like, well, if I say the obvious, the office manager will torture me, the dentist won't talk to me, or his wife will fire me. I mean, so what percent of the offices are safe and you can communicate and talk about goals and concerns and everybody's happy and fulfilled versus just living in fear, dysfunction, staff drama, all that bullshit? What percent of which?
So I'm not a percentage stats type of person. I like to reach the heart because you've asked quite a few questions like that, and I'm like, oh, I don't know. Like I'm going here. This is where I want to reach. Here, the heart. So I would tell the dentist to, if you haven't had a chance, read Simon Sinek's Start with Why. Understand your why, because everything starts at the head. You may have all these parts of the body and all of them come together to make this particular whatever it is, whatever your office, okay? But everything starts with the head. So if you're not clear what your philosophy is, what your why is, what makes you tick, what you're passionate about, nobody else will be. And then if you find that the people that you hire are not in alignment with your why, then you need to get rid of them and don't think twice. Because at the end of the day, if the head is not sure about what exactly is important to them, everyone else will be unsure. And that's when you get all those different personalities coming in and changing the whole culture and dynamic of an office. And that happens in academia, that happens in corporate, it happens everywhere. So whoever that leader is, they need to understand what's most important to them, what is their why, and put their foot down. And I think that goes with dentists. It goes with dental hygienists who are looking to do more in their career. It goes with dental assistants as well. But if, particularly in a private practice office, if that doctor is unsure of themselves on what their why is, then you see it throughout the entire entire practice. And you don't have to lead in a domineering way. You can lead in a way that could motivate and inspire the other professionals in your particular group to want to seek excellence also.
I want to be the 400-pound girl in my office, but I got to gain like 30 more pounds first.
Okay.
I'm only at 370. You have a lot of passion for the diversity, the transgender, the transsexual, and you also have a lot of passion for HIV, AIDS. Where does all that come from? Where does your passion for HIV, AIDS, transgender, the poor? Where does that come from on your journey?
So I like to correct you just and say I am passionate about cultural sensitivity, and it's not particularly with just that group. It's with so many others. I also speak on opioid addiction, but my journey began when I discovered how HIV affected people in my personal life. And when I discovered that, I was heading on to my baccalaureate degree program. And I was devastated in finding out those news because it was hidden from me for some time. So what I decided to do when I did my degree completion was to mentor, and I'm thankful to the University of Maryland School of Dentistry for allowing me to do that because no one had done it at that time, was to mentor with an HIV AIDS expert. And when I had the opportunity to mentor with her, she offered me a job, and I was delved into the HIV positive community, working with them. And having the chance to work with them, I had a large array of patients who identified as LGBTQ. So I had my first
LGB what? LBG
LGBTQ,
LBGTQ LG.
BTQ.
Okay, the only Q I've ever seen is DQ. That's where I get all my nutrition counseling at Dairy Queen. What does the Q stand for?
Queer.
When did they add that?
Well, it's actually 26 letters that make it up all together when you include everything.
Well, there's only 26 letters in the alphabet. Or is it?
I don't know the entire acronym by heart, but
I do.
You know,
A, B, C, D, E, F, G, H, I, J, K, L, M, N, P, Q, R, S, T, V, W, X, Y, Z. See, I memorized. That's how. By the way, what song do you like more? The ABC song or Twinkle, Twinkle, Little Star? Which song?
ABC, because I can really dance
or
to that.
Twinkle, Twinkle, Little Star?
ABC, because I can dance to ABC better.
You got the moves even when you're in a chair. Actually, that's just a little trivia thing. That is the same song, and it was Mozart. And if you ever listen to Mozart's rendition, it's like a 3-hour rendition. It goes through like aggressive, mean, sad, this, that. But those two nursery rhymes were both the same concert from Mozart. Twinkle Twinkle Little Star. But anyway, what is your favorite movie? I mean, I lived through that.
Philadelphia is the one that I can think of right now.
That was
Philadelphia.
Denzel Washington.
Yeah,
that was an excellent movie. Mine, I'd say that would be my second, but I love the And the Band Played On. Did you ever see that movie?
Yes.
Oh my gosh.
That's another one. That's another good one.
It was in 1981. Epidemiologist Don Francis learns of an increased rate of death among gay men in urban areas. The startling information leads him to begin investigating the outbreak, which ultimately identifies AIDS. His journey, I lived through that. I mean, that was 1981. I graduated from high school in 1980. My boy's mother's best friend, when I was in dental school, was in law school and died from it. The first person that died in my graduating class of UMKC 1987 died of AIDS. I mean, I lived through this. And again, it's bad now. It's bad now in 2017. But not compared to 1993. I mean, if anybody says AIDS is worse today, see, that's my deal. I'm an optimist. It gets better. Like the first 17 years of this century is twice as better than the last 17 years of the 1900 to 1917. Like,
but
AIDS
it's not
horrible.
It's not.
But
it's
not better than 93.
It is to some degree, but it's not getting where it needs to be. The HIV infection is still on the rise. When you look at young men of color who are MSM, who are males who have sex with males, there's a 50% chance of getting HIV. That's 1 out of 2. So we're talking 2017 when we have antiretroviral medications, and we also have something called PrEP, which is pre-exposure prophylaxis. And these patients or these demographics who are more at risk for HIV, they don't have access to it. The people who may not have the highest risk of acquiring it don't have access to it. So there's still a lot of growth that needs to happen. There's a break between the continuum of care when it comes to patients who have HIV, which is why the Jacques Initiative is starting this program where they're teaching dentists, they're teaching dental hygienists and all these different realms of health professionals how to do HIV testing. So we have dental students and dental hygienists who are learning how to do HIV testing and using interprofessional care so that you get more people tested, then you get more people that are aware of their status, and possibly more people that are treated.
I think you're so amazing. The only thing that confuses me about you is I've been to Maryland 100 times. You weren't born and raised in Maryland, or your mom or dad aren't from Maryland, because you don't have the Baltimore, Maryland accent.
I'm from Queens, New York City.
Queens?
Yeah. Which is
so
why
that's a Queens accent?
No, it's not. It's gone.
So you sound like someone who is from Queens and started to lose their accent in Baltimore, Maryland.
Yeah, it's gone. It's totally gone.
Huh.
Except for when I say coffee, or when I say I forgot. There's some other word that I say that my sister was saying. I don't really say anymore, but that's it. That's the only thing that's lasted. My accent is completely gone. But
I'll tell you what. I hope you load those podcasts on the Dentaltown app, because it'd just be great marketing. Your app, your podcast, MOMgienists, is on iTunes. Everyone who's put their podcast unloaded on Dentaltown, there's now 39. It populates across Dentaltown, Hygienetown, Orthotown. They say that their views on iTunes exploded because of the marketing of it. But so many people on their way to work, most podcasters have an hour commute to work. And they say they get in there and they open up the podcast and they just start scrolling down what in the mood they're listening to. And I just think sometimes they'll say, yeah, I listened to 10 of yours. Then I went to that Dentist Metrics. Then I started getting into implants or mark. I mean, it's just so cool. Mm-hmm. And I think you are so cool. I hope you write. I hope you do an online CE course for us on Dentaltown, Hygienetown's the same online. I mean, the online CE. I hope someday you do an online CE course for us. I hope you write an article. And I want you to know that you have a special place with me, because Howard Community College, where you went, that was named after me.
Oh my gosh, really?
Did you see my statue when you walked in the front door?
I totally missed it.
Did you really? Oh my God. Well, I'm glad I was able to talk to you so that you know that you went to my community college. But no, actually, seriously, in all seriousness, you remember when they had to take down the Rocky statue in Philly?
Yeah.
The same day they took down my statue at Howard Community College. They said both of those statues got to go.
I see.
But hey, seriously, love you, love your show, love everything you're doing. I think you're just one of dentistry's 1,000 points of light. Thank you so much today for giving me an hour of your life and coming on the show.
Thank you. I appreciate it. Thanks for having me.
All right. Have a rocking hot day.